Hello, my name is Dominic De Los Reyes, and I am the program coordinator for a program at UPAC, or Union of Pan-Asian Communities, called Community Health Worker Communication and Outreach Services, CHWCOS. And we provide COVID-19 information and resources to residents of San Diego County, especially from Native Hawaiian, Pacific Islander, Asian communities, and those more impacted by the COVID-19 pandemic. So thank you for joining me today, Audrey. Would you like to introduce yourself?
Sure. My name is Audrey. I am a second year physician assistant student. So I'm currently on my clinical year out in different fields, but currently in a hospital system that sees a lot of COVID patients. I work with the doctor who's admitting patients from the emergency room who need to stay in the hospital overnight or for many nights. So I would say right now, about half of the patients that we're seeing stay overnight are suffering from COVID. So I really see the effects, and I'm talking to people every day that are affected by COVID, and hopefully sharing my experience can help some of you out there avoid that hospital stay that nobody wants. First off, I'll say, it's hard to tell, really, even for doctors, who exactly is going to get really sick or not that sick from COVID. You would think it would be the lifetime smokers, 85-year-olds with lots of other diseases who are the most sick, but we are seeing younger people, even in their 40s, who don't have other medical problems, come in really sick and needing to stay overnight. So there's not really a, exact person who is always going to get sick, or an exact person who's not going to show any symptoms. So that's kind of scary. Obviously, best to avoid it in anybody. Don't think just because you're young and healthy or not on a lot of medications that it won't really affect you seriously, because it can. Another thing is that the emergency rooms are very, very busy. They're very full of patients coming in who maybe know they're positive or think they're positive, are having certain symptoms. And just due to the volume that comes in, only a few of them can stay and really get sustained support. So a lot of people are getting sent home with O2 monitors that they'll put on their fingers and being told, if your number drops below this percent, come back in. But right now, even though you look miserable, we can't really do much for you here because we have to save the beds in the rooms for sicker people.
So they're measuring their oxygen levels, and if
Yeah,
not getting enough oxygen, they need to come back in.
exactly. So really, when people are staying overnight, it's because their oxygen need is so great that they cannot be on oxygen at home to support their levels, and they're at risk of deteriorating so quickly that somebody needs to be constantly monitoring them. Fortunately or unfortunately, if you just feel like you have the flu, nausea, vomiting, loss of taste or smell, other COVID symptoms, but you're not actually having a hard time breathing, you're probably going to wait in the emergency room for many hours and then be sent home, because there's just not enough room to keep caring for you there. And then once people get admitted and stay overnight, their course can be as quickly as 1 to 2 days, or some people are in for weeks, obviously. It's just monitoring whose respiratory status improves or gets worse. And obviously, as it gets worse, the last stage of that is intubation. We're actually on a ventilator. And that's a really scary step I've been seeing in the hospital, because a lot of people who go on a ventilator might not come off of it, and they're sedated when they're on the ventilator. So they're not really, and they're not able to speak, obviously. So
Why are they sedated when they're on it?
to have a tube down your throat, you can't really have the gag reflex or be pulling it out. So
Wow. I
yeah,
imagine it'd be very panicky, like
Yeah,
calm you down because there's this thing down your throat and it would feel like you're choking or something.
exactly, exactly. So if somebody is in such respiratory distress that they need that, we call the family in to kind of have these conversations. Or, I mean, you're not obviously saying goodbye at that point, but it's just a scary step because if they don't come off of the ventilator, if their lungs don't start working again themselves, then that might be the last time you get to have a conversation with your family member. So that is a really dire point that hopefully, people don't have to get to.
So, if I can ask, what's like a typical day for you at work? Like, are you seeing a lot of people in like serious emergency situations? Um, or are you getting to see people, recovering and getting to go home? Like, what's the kind of atmosphere where you're working now?
Yeah, it's pretty variable. And the hospital I'm at is not super large. So um, it really varies day by day, but the position that I'm in right now, admitting people, it's the most sick of the sick. So if people go home from the emergency department, I never meet them. If they need to stay overnight, I kind of get everything in order for what they're going to need over the next X number of days that they stay.
Like
And
what?
then right now, the hospital I'm at, the protocol is Decadron, a steroid, and remdesivir, which is an antiviral that is used if the patient needs more than 4 liters of oxygen and if they've been infected in the last 10 days or their symptoms started in the last 10 days. Um, and that is a 5-day course, and the steroids are a 10-day course. So, and then of course, oxygen as needed. And then if other lab abnormalities are out of whack, they need to get corrected as well. Anything else that that person needs, if they're diabetic, they're going to need insulin, kind of looking at their full picture and what else they're going to need when they're in. But that's like when they're coming in initially from the emergency department. And then every day we check in on those patients and make sure their respiratory status hasn't declined. The nursing staff on the floor will determine that based on their oxygen saturation. And it's a bad day when you come in and check your patient's chart and they were intubated overnight because they just declined so drastically. But I have seen, I would say, there's also other medical problems that need to come into the hospital, right?
Yeah,
Maybe with the hip fracture,
everything before COVID.
everything, yeah, nothing else stopped. So people are still having strokes, heart attacks,
Yeah.
breaking their hips. And so for me personally, yesterday, just as a snapshot,
Yeah.
if I admitted 10 patients, 5 of them were COVID and the others were medical emergencies. And of that 5, I mean, it's hard to say, but a couple will probably go home in a day or two, hopefully. And then I have had patients who have been there for 7 days with COVID and are still needing a lot of support. So who
Hmm.
knows if they'll make it and go home or not, but it's all just unknown.
So then as a healthcare worker who is, you're exposing yourself to COVID by just going to work every day. What do you do in your day-to-day routines to try to minimize your own risk of exposure?
Yeah, so thankfully I was lucky enough to get the first dose of the vaccine,
Yeah.
but that doesn't mean anything in terms of my habits on the day-to-day job
Well,
because
and doesn't it take a while for your immunity to kick in after getting it too?
right. So I got the Pfizer vaccine, and the research on the Pfizer vaccine says that after about 10 or 12 days after the first shot, my immunity is maybe 52%, and then it'll go up to 95 after the second dose. But there's still not enough research out there or evidence to say that even fully vaccinated, that you can't be an asymptomatic carrier. So even if I'm not at risk myself, I'm still taking all the precautions so that I don't spread it from patient to patient, obviously.
Okay.
So I just wash my hands very frequently, use a lot of hand sanitizer. before going into any room, really any room, but especially if you think the patient might have COVID or has a confirmed case already. There are gowns, a nice cute hat, shoe covers, and obviously I wear an N95 mask and another mask on top of my N95, and I stitch
Yeah,
out my.
I was wondering why I've seen people doing that, 2 masks.
Yeah,
Save supplies or
I think that it just makes you feel like you're keeping your N95 clean, the outside of it,
okay.
because the more disposable masks on the outside you can kind of replace more frequently, but then your N95 I'll keep for a couple days until I feel like it's grimy and then get another one. And then of course eye protection. I wear glasses and goggles. And then with my hat, it's really cute. But
Because like, can people get COVID through their eyes? Like, if they get respiratory droplets that are infected with COVID, like it gets in your eye somehow, you can get it that way.
absolutely, yeah,
Good
that's
thing
what
I
the
wear
research.
glasses all the time.
Yeah, good to wear glasses all the time. Actually, I used to wear contacts every single day. In March, I haven't worn a contact since because even if I'm not in contact with COVID patients every day, like I wasn't back in March, I still felt like I touch my eyes a lot more when I'm not wearing glasses. So protect your eyes, especially if you're on COVID.
Thanks. I'm also curious, like, if you're having conversations with people outside of work, and like, do you like where you live? Maybe do you come across people who have just no regard at all for this kind of daily battle that healthcare providers are doing in hospitals and other healthcare facilities? Like, does it seem like people acknowledge that outside of healthcare settings?
Yeah, to be honest, I don't talk to a lot of people. I don't see a lot, anyone that's not in the medical field right now. But I can tell you that even some patients who come in with COVID don't believe that it's COVID that they have and don't really take it seriously. Um, so that is a bummer. But yeah, I think there's a big disconnect because it's easy to forget if you're not in a circle where anybody's been affected, especially. But yeah, every day when I walk into the hospital, look into the ER, the beds are always completely full. People are in the hallways lined up to get care. There have been shortages of different types of equipment almost every shift, whether it's this particular tube that can carry higher flow of oxygen that is needed for more serious patients. One day there were no more of those tubes, so that was a big problem, obviously, and then they got more. But every day it seems like some other piece of the puzzle is missing that no one ever thought they would need so much of. um, One other thing I thought of is that I was talking to a woman yesterday who was admitted. She was in her late 70s and she was presumptive COVID. So when someone comes in and they can't breathe and are coughing, we still don't have that many rapid tests. Actually, every single day, the emergency department only gets 10 rapid tests that they have to decide who to give to.
Wow.
Everyone else gets the swab that takes at least a day or two. But if somebody looks pretty bad, we can do a chest x-ray or more imaging of their chest and look at their lungs, and it's pretty clear they have infiltrates in their lungs in particular manner that is very consistent with COVID pneumonia. And so this lady yesterday, she had not tested positive, but looking at her lungs and her clinical picture, it was very suggestive of COVID. And I was asking her if she had had any contact with anybody who knew they had COVID, or whether she, wears a mask, or if she thought that she could have been exposed. And she said, no, I don't think I could have got it. And I asked her, what she did over the holidays, if she lives alone, anyone else in the household, these types of questions. And she said, I have a big family and we all got together for Christmas, but I couldn't have got it because everybody got tested before coming. And I was like, that's not really at all, like, you can't confirm that nobody had it, even though they had a rapid test or like any type of test, because they could have got exposed right before they got swabbed and the swab was negative, and then they developed the virus within the, they developed symptoms or didn't have symptoms in the next couple of days and just passed it on. And a lot of family members, I mean, it's very, very clear when I ask the question of confirmed COVID people, they say, yes, my daughter-in-law had it, but she was okay. Or yes, my daughter's friends or my mom had it. Or it's very rare that multiple people in families aren't getting it. And I understand it's difficult to isolate if you live with somebody who has it, but these holiday gatherings are really coming through in the numbers right now. It's starting to pick up because the contacts really just have increased in the last few weeks, I feel like. So
Yeah, it's almost like an exponential, like a multiplication, because of increased contact with people who weren't living together before. They meet for the holidays, and then after, it incubates for a few days, right, and grows inside somebody, and then they don't know they're contagious, and they're, meeting more people, and it's really hard for, um, this whole contact tracing system to be spot on, because it's like keeping track of this kind of stuff isn't something we're all used to. Like, who did I
yeah.
see the other day? I don't know. I don't remember. Yeah, and it's so scary. And a lot of this is like really negative stuff, like seeing this day in, day out. Like you're face to face with it more than the average person. But I also know you to be a very like positive person who is able to uh, you know, like look at the bright side of things and kind of, at least on the outside, right? You appear okay. I'm just curious, like how you handle this.
Yeah. I think just due to the amount of time we've been dealing with it, I think a lot of doctors, especially that I've talked to, have gone through waves of complete burnout and then feeling like, wait, this is why I'm in medicine. This is what I am
Mhm.
meant to do. Like, my time has come to make a difference and I really matter in this fight. And then, at some points, you just have to laugh about it. The doctor that I'm working with right now is always joking about COVID, which is, just maybe like a coping mechanism. But at some point, you're just in it so much that you can't let it affect you that much, or else you aren't going to be able to perform your job. And that's what really matters in taking care of these folks. So
Yeah.
you just do what
Right.
you can and realize that we have come a long way. I think getting the first shot in the last few weeks, all the doctors and nurses that have got it's amazing. It feels like such a miracle because the history of vaccines it has never been this quickly developed, obviously,
Yeah.
and it's so promising for the future. This kind of new mRNA technology that they've come up with, they're gonna try to apply it. I've read the other day for the flu and a couple other things, because the flu shot is, if it's 50% effective one year, that is like amazing for the flu vaccine. And that's not very effective. They're always guessing, and it's just not, it takes them a full year guessing the strain. And I just
The
feel
virus
hope.
evolves too, right? So it's like
Right.
kind of got to guess at it.
Right. And this new mRNA technology should work against different strains of COVID. So that's
Even
really,
the UK one?
that's what they say. I'm not a medical,
Yeah, okay. So we'll
disease
leave that. We'll
expert.
thank
But
for more information.
yeah, preliminary research says it should be, I don't know if it'll still be 95% efficacious because the research studies were obviously done with this strain. And so
Yeah.
it's hard to,
Without data, it's hard to conclude.
yeah, without the data, it's hard to back up.
Yeah.
But the way that the science works, theoretically, it should be easier to, if it needs to be adapted to other strains, it should be easier to do so. So I feel
Okay.
like it's really hopeful. The future, we got to get back to normal eventually. And the more people get used to living this type of life, I know just connecting with others online or, 6 feet apart outside, people are kind of getting into the swing of things and realizing I would rather have this end than go dine in a restaurant every night, So
Yeah.
hopefully we'll get back to normal at some point.
Yeah, yeah. We're all putting in so much effort, and there's never been so much money invested in the vaccine developments, and folks are, on small scales figuring out the situation, and like teachers, everybody's making do with all of these required changes, but I feel like we'll get out of it at some point too, and hopefully sooner rather than later. And thanks for your help in that as well. I really appreciate that you're a medical provider and you're so smart. So it's great to see that, you're putting your brains to work on this pandemic as well.
Thanks.
Yeah. Any anything else?
I can't think of much more than wear a mask, wash your hands,
Yeah,
do your
physical
best.
distancing, take care of your mental health. Caregivers, take care of yourselves as well. Don't forget, right? And let's all keep up a good effort and trying to keep ourselves and others safe and healthy and happy.
Yeah. Thanks for all you do, Dominic, too.
Oh, thank you. And thanks for your time. And I wish you the best in the course of your career.
Thank you. Thank you.
All right. Take
All
care. See
right.
you later.
Bye.
Bye.